on the news items we'll be sharing with you at this hour. And we start off with the public participation that is geared to start tomorrow. Now, the National Assembly has published a form highlighting the alleged violation in the impeachment motion of Deputy President Rigathi Gachagua, which will be filled by Kenyans during the Friday's public participation exercise. Kenyans have been given 3 options to indicate their views in the motion, to either support, not to support, or specify any other reason regarding the motion.
Honourable members, I have a short communication on the public participation program on the special motion for the removal from office by impeachment of His Excellency, the Deputy President of the Republic of Kenya.
Since the declaration by the National Assembly Speaker Moses Wetangula
inviting submission of views and notifying the public of hearings on the special motion, list all 290 constituencies and indicate that the exercise is to be coordinated from 47 count venues or collection centers across the country.
Parliament has since circulated forms where Kenyans can have their say on the impeachment motion against the second in command.
Lakini unajua wengine wanajaribu, nimeona wengine wananisindikisha, sasa wabunge 300 wamesaini, sasa wewe you are die cast, si ujiuzuru uende nyumbani. Sasa mimi nijiuzuru, hii kazi mimi sikujipea.
The form will require members of the public to fill in personal information, that is full name, gender, constituency, county and their identification number. The form has 3 options: in support, or not in support, or any other specified reason. The form indicates all charges facing the Deputy President, and those in support will be required to tick the appropriate charge. They are then required to sign at the bottom of the form and indicate the date they participated in the exercise.
The grounds themselves constitute about 42 pages, and with the rest of the material, we have about nearly 100 pages.
Parliament has further directed that filled templates may be delivered to a collection centre indicated in the schedule of the public hearings on the 4th of October 2024. The clerks of the National Assembly have been designated to collect and compile the public views in regards to the impeachment motion against the second in command at the specified meeting points across the country.
The security of members whose support of the special motion may affect their personal safety.
And of course, we'll cover those public participation that is set for tomorrow, where the clerks are designated to the various areas that have been stated in the public statement issued by the Parliament. And of course, that will be our key focus this evening. But to the statement that the Ministry of Health has just issued on 6 thematic areas of concerns to the public, where the ministry has clearly stated that they have clarified on the discharges from health facilities where all patients admitted under NHIF packages before the September 30th will be discharged using NHIF system, and no patient should be detained in health facilities. Secondly, on enrollment without consent, the ministry has received inquiries regarding the transition of existing NHIF members to SHA. We wish to clarify that the laws as per legal notice 147 of the 2024 provided for the transition of all registered and verifiable NHIF members into SHA. This process ensures continuity of coverage, and members are encouraged to verify, update their profiles and add dependents through the official SHA channels. Secondly, in terms of service provision system, the ministry clearly states that technical teams are working 24 hours to address the increased use of demands on various systems and enhance service delivery. Kenyans, of course, have been urged to keep experiencing smoother services as the transition progresses. Fourthly, the services provided under SHA offered expanded services compared to NHIF, ensuring enhanced access to healthcare at all levels. Now, the ministry has committed in ensuring no disruption in services during this particular transition. Now, to access of services, all public health facilities and over 60% of private health facilities have been contracted contracted by SHA and should provide health services similarly to that aspect. Now, an updated list of these contracted health facilities is available on the SHA website, which will be continuously updated to reflect the changes and additions. And of course, we are following on this update that we have just received from the Ministry of Health.